When Mr. Orogun was speaking earlier, he talked about misdiagnosis, and then Professor Amira had tried to, say that well, if you're being treated for malaria, too much, you should check your kidney. I'm asking, should the patient tell the doctor what to do, or the doctor should know what to do? I'm just thinking. So, but please speak to us really about these issues, because when you talk about these kind of conditions, cancer, kidney, and all of that, there's always that issue. Even for patients that present themselves in hospital, the early detection is not there. Is it a lack of infrastructure, or is it that the manpower are not skilled enough, to do the basics, to get, some of these diagnoses right? What exactly is the missing link?
Thank you very much. There are a lot of issues. One, in our own culture, when somebody is ill, the first contact is not the hospital. People go to the chemist, people go to friends and neighbors to seek for help. And this one are not, in most cases, these are not qualified enough to thoroughly assess the illness and know what to do. And when they go to public hospitals, most of the times, the population is large, and the concentration of the doctor is not even there. And most of the public hospitals are not, the first contact are usually not the qualified medical doctor, we all know. So these are some of the issues, but what we are advising Nigerians is that don't wait for you to be sick before you are diagnosed to have kidney disease, because there are advantages of early detection, because chronic kidney disease are staged from stage 1 to stage 5. Is when it reaches stage 5 is the time that you are talking about kidney replacement therapy. But if it is detected early, there are measures that can be taken to slow the progression. Because ordinarily, chronic kidneys, when it starts, it progresses. So what the qualified physicians, specialists in the area does is to slow the progression. There are measures that we can take that if you are detected at stage 2, for example, we can slow you from progressing to stage 3, stage 4, and stage 5. So Nigerians should not wait for them to be ill before they are diagnosed to have chronic diseases, not only kidney, even heart, even brain, even lungs. That the culture of regular checkup that was emphasized earlier by my colleagues is very important. And in terms of preventing kidney disease, in terms of early detection and so on, there are golden rules that you should follow and you keep your kidneys healthy. One, you should exercise and be fit. And then take adequate fluid. Your water intake should, under normal circumstances, shouldn't be anything less than 2 liters in a day. But in certain conditions, in certain situations, you can be advised to reduce or to increase. But don't joke with your fluid water intake. And then if you know you have high blood pressure, you should do as much as you can to control the blood pressure. Avoid stress, as it has already been mentioned. And then be regular with your doctor and make sure that you and your doctor discuss about the target control of your blood pressure. And when you have diabetes, you should also do as much as you can to control your blood sugar. This you should also discuss with your doctors and agree on a target control of your blood sugar and work towards achieving that target. And diet is very important. Know what you are eating, because through excessive taking of salt, for example, can damage the kidneys through causation of worsening blood pressure control. And there are foods that are not good for your health. You should also avoid them. And then over-the-counter drugs. These are also dangerous. These painkillers that are commonly available in chemists, in people even carrying it on the streets, they are not good for your health. And small doses of these non-steroidal anti-inflammatory drugs like ibuprofen, Buta, Indoseed, aspirin that are being carried around they can be dangerous to the kidney, and they can cause kidney damage of permanent type. And then when you are obese, you should control your weight, because obesity is also known to be a risk factor for kidney disease. So when you look at these rules, you take care of them, you'll keep your kidneys healthy. So my advice is that don't wait until you are sick before you know about the function of your kidney and other vital organs of your body. In regular checkup, and even when you go for malaria, to know the functions of the kidney is not difficult. Even through urine tests, Dr. Koipa mentioned it. Simple dipstick urine that it can be done within 2-3 minutes. You can know the kidney health and what health status is this kidney at the moment. So I advise that Nigerians should be careful and be worried about the kidney health, and they should insist on regular check of the kidney function, and the healthcare professionals should also do their best to help patients, that when they are detected, they should be referred to specialists early enough, so that appropriate measures are put in place to slow the progression of the disease. Thank you.